All right. Thank you folks for joining. I'm gonna share my screen and we will get started with today's session. All right. Hello, everyone. Thank you so much for joining. We are Pre-Health Shadowing, an international student-led nonprofit for medical advancement. Our team is really passionate about sharing knowledge about all pre-health fields with pre-health students to kind of share the wealth as we have folks that are transitioning into new careers or joining the medical field in general. So we're really happy to have you all here today. We do have closed captions available. This is to accommodate all students of all abilities and needs. If you have any ideas about how we can make our sessions more accessible, please let us know. You can email us at info@prehealthshadowing.com or message anyone in the chat that's a part of our team to let us know. Just in general, that email is a great one to have. That way you can get all of our correspondence and stay in the loop about all of our sessions. Please make sure to save us as a contact, keep us out of your spam. And if you ever have any questions or want information about any future sessions, we'd be happy to correspond via email. Additionally, if you want to stay in the loop, we have a bunch of social media platforms, anything you can think of: Instagram, TikTok, X, YouTube, Facebook, LinkedIn. Special shout out to LinkedIn. If you want to expand your professional network, please follow us over there and repost anything that you see. That way we can stay in the loop. All right, to start off our session, our PHS headquarters is located in California, but we realize that we have students from all over the world. So please drop it in the chat where you are from. We love to see where everybody's zooming in from. I am from California, born and raised. Toronto, Canada, Chicago, Paris, California, a lot of California folks, some New York. Someone said they go to school in Santa Barbara. I actually went to UCSB, go Gauchos. Las Vegas. Wow, that's great. It's cool to see everyone from all over the map, and we realize that time zones are a thing, and we are really thankful that everyone's willing to join whatever time zone they're in to engage in this session. If you are interested in becoming a member of Pre-Health Shadowing, please be sure to go on our website and register as a volunteer. All of our opportunities are 100% remote, so from wherever you're zooming from, you can be a part of our team. And if you have a little bit more time on your hands, so you can donate about 5 hours a week, you could be a part of our leadership team. We do have a full list of leadership positions that are open, so please apply online today. Or if you want any more information, feel free to email us or chat anybody from our team. On the screen right now, I have a list of available roles, but we're also very flexible in terms of expanding the leadership roles that we have in pre-health shadowing. So if you see any gaps in our program thus far and want to jump in and create a new position, please let us know. If you are a high school student, we do have a high school training program opportunity, so you can bring pre-health shadowing to your school. Again, that would be 100% remote. You would communicate with our team, so please fill out an interest form. That way we can bring pre-health shadowing to you, your campus, wherever you are. If you can, we would love it if you could donate to keep our program free and accessible. Our program runs 100% on donations, so if you can donate any money, any amount is great. If you can't donate money, we would also appreciate you donating your time. So like I said, we have a variety of volunteer opportunities available. Additionally, if you wanted to send this QR code to your network, anybody that you know that is interested in helping the future of pre-health, please make sure to share that with them. During our session, we are taking questions. Our team is noting them down. So please ask as many questions as you would like in the chat. And then after Dr. Gruen is completed speaking, we will have a dedicated Q&A. So make sure that you're thinking of questions, typing them in the chat so you don't forget. Also, it's very, very helpful if you take notes during the sessions. A lot of time there's a lot of new vocab or new opportunities, new positions, new universities that we talk about. So it's great to take notes, and it will definitely help you with your post-assessment quiz at the end of our session. Lastly, we do like to engage in as much of an in-person, human-to-human form as possible. So if you can turn on your video, it's great. We love to see everyone's smiling faces. Give us a little wave, make your background fun, whatever you need to do. We realize that it's not for everybody. Some folks aren't in a place where they can turn on their video, but we appreciate when you can, and we welcome you to do so at this time. All right. We are so excited to have you all here on this session, and I want to introduce Dr. Gruen. We're so excited to have you here, and you have the floor.
Hey, thank you so much for the invitation, and just a disclaimer, because I had no idea there were going to be so many people that I was going to be talking to such a large audience of people, and I I ran over. I've been doing an academic day. I was in the library, so I had to run and get my car, and so that's where I am, and which is obvious. But I'm explaining why I'm in the car and why I'm dressed like this because it's an academic day for me. And I guess the other thing that, in terms of disclaimer, before I start to talk about myself in medicine, is just to let you all know that one of the things that I'm spending a lot of time on at this time in my life is I'm interviewing undergraduates who are applying to the Keck School of Medicine. Keck is University of Southern California here in Los Angeles. So I have been speaking lately to a lot of people who are they're farther advanced in terms of most of them have taken the MCAT exam and they're at the final stages of becoming medical students. So they've made the commitment that I assume most of you are trying to decide if you want to or not. Um, but I do have a, a I have some sensibilities to where you're coming from. So it is a great privilege and pleasure for me to be doing this. So to introduce myself, my name is, last name is Gruen, Gruen. First name is Peter. I am a 71-year-old, prefer him, he is my pronouns. And I was born and raised in New York City. Did live in Long Island for a while, and that's relevant because that's where I went to college. I graduated from Yale University in 1976, and relevant to all of you is that I had at the time, I graduated with a degree in history and was very concerned. In fact, my mother was more concerned that I was going to have difficulty getting a job as a historian. And so I was able to, I had begun learning Chinese. And so through Yale, I got a teaching fellowship. I was sent to Hong Kong. And so I lived in Hong Kong for 2 years, during which time I did some volunteer work at a resettlement area. At that time, this is long, long time ago, there were a lot of refugees from both mainland China and from Vietnam. And so I worked at a resettlement center with children. And one of the mothers of the when my program was ending, I was only had 2 years, and so at a farewell dinner, one of the mothers said, "So, what are you going to do with the rest of your life?" And I said, "Well, I would really love to come." And at that time, I was very, I guess it's fair to say for the last 50 years, I'm a Sinophile. So I was like, I would love to come and work and serve the people of China. And the mother, she looked at me and she said, "Well, you know what? In China, we don't so much need English teachers. We don't really need history teachers. We need doctors." So that conversation was really the reason I became a doctor. I came back from Hong Kong I had a friend who taught special education, and for 2 years, no, for 1 year, I worked in at the most difficult job in the world is teaching special education to adolescents. But that was my assignment, and during that time, I had exposure. The school that I worked at collaborated with the Yale Child Study Center. We were near New Haven, and so that was why I decided at that time. Wow, it sounds crazy now, but I decided that I wanted to do neuro, and I wanted to work with children. Um, and then, oh, I had to go back to be a pre-med, and had to scramble to find the money to do that. But I did, and a lot of the courses that I had barely passed in high school, because I really, really had decided I wanted a career in as a doctor. Um, I actually aced calculus and physics and chemistry, organic chemistry. Um, so it was a great challenge, and I was successful in being admitted. I went to Columbia School of Medicine. It has a fancy Physicians and Surgeons was the name of the medical school, and I continued to want to do neuro. And so when I finished at Columbia, I applied for a residency in neurosurgery. I came out and interviewed. I went to several places, some back east. I also interviewed in San Diego, but it was in Los Angeles. I had come out here to Los Angeles with a friend, and we walked into the Los Angeles County Hospital. And I know you guys are from all over the country and all over the world, but you have probably heard of Bellevue, the hospital for that was my dream. From a very young age, I wanted to serve the underserved population. It's just is my thing. I think it's probably genetic. And so when I walked into the Los Angeles County Hospital for my interview for neurosurgery, my friend, it was like, oh boy, he said, this is where you belong. And the Department of Neurosurgery agreed. And I ended up coming out here to Los Angeles. I had never really been in California. Um, all I knew about California at that time, well, this is how old I am. All I knew was the Beach Boys and the Mamas and the Papas, and that everybody out here was pretty crazy, and they spent the whole day at the beach. But I will tell you that as an intern and a resident at the County Hospital of Los Angeles, it was very hard work and very interesting. The School of Medicine of USC, which is now called Keck, there were some excellent clinicians, and I also did do some of my training at the Children's Hospital here, which is one of the best in the country, and some private practice as a resident. So I think I had, and just in terms of ratings, our neurosurgery program here at USC is one of the top rated. So I felt like I got very good training. And then I can't say, yes, I was totally surprised when the chairman called me up a few months before I was graduating and said, we'd like you to join the faculty. And when I got over the shock, I was like, are you kidding? Of course. And so I ended up, I've been here now for, this is like 39, 40 years, and at the in the School of Medicine, at as a faculty member. But most of my clinical work I had private practice probably for 20 years or so, but um, at some point it wasn't it wasn't that I didn't want to do neurosurgery. I loved neurosurgery, but I wanted something else, and somebody told me, you know what? Maybe you should try being an administrator or learn about administration, learn about resource allocation, learn about the healthcare system. And after 4 or 5 years, I ended up being the chief of staff at the county hospital, and then abruptly the chief medical officer, who is the C-suite guy, a doctor. For 2 years, I was the chief medical officer at the county hospital. After that, I continued to teach neurosurgery and do neurosurgery, but much less private practice. I was exclusively almost at the county. And I was in charge of utilization review. I was in charge of actually the best experience I would say in my whole medical career was I ended up being the director of critical care at the county hospital. We're in East LA. This was the epicenter of the COVID epidemic in California. And so for 18 months, I was rounding every day on 90 ICU patients. We had I'm not bragging, I'm just saying reality. For a county hospital, we had some of the best data in terms of our mortality and morbidity. The county hospital here is excellent. Let's just put it that way. And so I just kind of rode on the hard work of the nurses, who I can't say enough, the real heroes of COVID. And it was a gift. It was a real gift to COVID really validated what you all are wondering is like, how rewarding is, would a career in healthcare be? And the most rewarding experience I had was critical care during the COVID epidemic. After COVID was over, I went back to neurosurgery, and actually maybe 3 months ago, I have retired from the county hospital, and I am working private practice across the street at USC. And what am I doing? I'm interviewing medical students. I have a website and on neurotrauma critical care. And I suppose that I don't know. You'll have to decide when you have your own medical career, but I will, no matter where I'm working or not working or part-time or full-time, I am always a neurosurgeon. I am always a doctor for my whole life, and most important, a patient advocate. So is that enough? Have I introduced myself? I'm sorry, I went on and on and on, but
No, that was
what
perfect.
else? What else can I say?
Um, we appreciate you sharing thus far. Thank you for going on and on. Please continue to do so. Um, Kind of talking about your career, would you describe yourself as more of a non-traditional student? And if so, how was your transition to taking those classes after you completed your BA in history?
Oh, it was well, for one thing, and this is really I love doing this. I don't know who's listening here, but I'm sure there are people who kind of had the same thing that I did. Back in the 80s, the model, most people who went into healthcare, when I was at Yale as an undergraduate, I was going to be a lawyer, and that's why I took all those liberal arts courses. And but I always wanted to, like I said, I always wanted to help, serve the underserved, that kind of thing. So come back from China, and I did my, a couple of years. I also I went to Paris, and lived in Paris for a year because, okay, and this is uh, neurosurgeons maybe were not so smart. I had somehow convinced myself that if I lived in France and went and entered the university as a student of Chinese, that it would be no big deal if I just transferred into the faculty of medicine. And so when it came to January, February, and I went to the medical school and said, "Oh, I just want to transfer into the medical school," they were like, "We have 60,000 refugees from Southeast Asia. Go home to America." So now, by the time and then I had to do 2 years of pre-med. So by the time I started medical school, I was 6 years older than everybody, most people. So at that time in 1980, that must have been 1982, the model was that all of those people who were pre-med with me, the model was is that you decided when you went to college that you were going to become a doctor, and the term that we at Yale, I don't know if you were a gunner. And so you did you were in the library all the time. You were, pre-med. It was like, oh my God, those guys are working so hard. Um, but but they went right into medical school. And, so I don't know the word you use. It was unusual for somebody as old as I was, 6 years older. So even in the pre-med courses, um, uh, how do I say it without sounding like a housewife? I had no friends. I had no friends because I was old and I didn't, I just socially it was awkward for me already. Only 6 years, right? Who knew? So, but I think for you all, the model. So let's say at that time the usual student was probably what were we, 22 and a half, or and then there was a smattering. I think you could update me, but I've heard that it is not at all unusual for people in their late 20s, early 30s. People did not do career changes. Like, I was an investment banker and then I went back to medical school. I didn't know anybody like that. So yeah, I was kind of if I get really histrionic about it, I felt like a freak. It was yes, it was unusual. It was very unusual. But and then when I came out, it was interesting when I came out here to Los Angeles. And this was typical. Every place that I went, so I'm 6 years older than all the other graduates from medical school, and the first question that every department chairman I was interviewing at was, you're a bit older. How do we know that you really have a commitment to be a neurosurgeon? And that was the same question that I got when I was applying. You know why I got into Columbia for real? The the first question was, wow, oh, this is so wonderful. You have all these experiences. How come you're so old? But the guy at Columbia, you had to write on a piece of paper. You had to write with a pen and write your essay. And the guy says to me, well, you are a bit old, but you have the most beautiful handwriting I have ever seen on an application. You're in. Okay. So anyway, yes, I was different. I continue to be different. I think different is good. And nowadays, I'm so happy for you all. I'm not jealous. I'm very happy for all of you that and I've learned this from interviewing medical students is no matter what the current administration says, the real strength of our healthcare system is the diversity. And so there's all different. There's all kind. You know what? There is no unusual anymore. It's all good. If you're willing to, even with artificial intelligence, it's still very difficult. There's a lot to learn. and it's very challenging and physically very difficult. But I know I'm rambling, but I am answering, I think, the question. And then in terms of just unusual, it was extremely unusual when I got to the LA County Hospital with the other surgical residents um, to be 6 years older. But I gotta say, you know what, those younger people, I I could do the night call. I could do the, I physically and intellectually was right up with them. Now at 71, at 20, somebody who's 28 versus 22, they're kids. But when you are 28 and your colleagues are 22, you perceive it as a real big difference. And I don't know how much unusual do you want me to be here?
Whatever you
Uh,
see fit. We have a question kind of along that same mindset. A student said that they're entering medical school after a significant life and caregiving experience, which gave them a strong sense of purpose. When considering mentorship in neurosurgery, how do you evaluate readiness and fit beyond the traditional timeline?
I'm glad that whoever, excellent intro is for me. And so fitness for neurosurgery, but also now that I'm doing the interviewing, fitness for being a medical student and being a physician. It, I don't, I can't come up with the I can't come up with a set of, everybody is different. And like I say, I'm a diversity, um, I'm a diversity advocate, and so I take everybody. Uh, there's all kinds of life experiences, and there's not just one experience or one. And by the way, I also, my experience of being with people who decided they wanted to go into neurosurgery when they were in first grade versus the ones who decided, they were half through medical school and they were going to be a urologist, and then at the last minute they decided to go into neurosurgery. I don't really think that the ones who decided when they were children are any more qualified or likely to succeed. I if I know your question is not who is likely to succeed in my mind. It's the, I don't know. I'm glad that I don't do these interviews in person, but from the body language and the tone and the way that people answer their questions, you can get a sense of what people's commitment is. And the other thing in terms of not knowing the time that when in your life you decided that you wanted to go on the journey, the healthcare journey, that is not important. And then the other thing that I think is, this probably does make me an unusual interviewer or an unusual mentor, is I'm not really a big one and I think this is true even for undergraduates, is that I've heard that things like the SAT, there are some schools that don't even do the SATs anymore, accepting people. And that people have to have straight A's in all of their pre-med courses. I just don't think that being a good student necessarily indicates that you are going to be a good doctor. The most important and the most important quality that I think, the most important ability is the ability to communicate, and to be able to communicate. And it's tough because when you're communicating with patients who may or may not speak your language, who may or may not be of the same cultural background as you, um, you have to be on your toes and sensitive to all the spectrum of different personalities and of your patients, but also in terms of working with a team, you have to be, and I don't know if yeah, I guess the word would be tolerance and openness, um, and sincerity. I think those are the qualities that I think are most important in physicians. And competency, obviously, as a surgeon, if you can't operate, then you probably shouldn't be a surgeon. And if you can't read a lab report and know what each one of those numbers means, and figure out how to identify trends, and there are some definite intellectual uh, skills and abilities that you need to develop. But most of them, I think, if you don't have them coming in, by the time you're done with medical school and training, if you've really put your mind to it, you'll acquire the skills that you need. Um, but it's not. I I don't want to discourage anybody, but I had always felt at Columbia in medical school that we had what was it called? This is back in the 80s, but we had like these, we would call them touchy-feely sessions, because this was in its infancy, right? And so, the concept of being sensitive and being perceptive or whatever wasn't part of the playbook of medical school at that time, but it is now. And even at that time, the I was always skeptical that if you weren't, I don't know, born with it, but at a very young age, actually, when I taught special ed, this is what I learned. And I also taught it in Hong Kong, was your values and the way that you see the world and the way that you approach your relationships with other people. Um, I hope I don't offend anybody, but I really think, that old saw of, I learned everything in the sandbox. I think there's a lot of truth to that. And I think if you're not a good person, um, you can you can still be a good physician, but if you're not a good person, it's going to require, you have to at least learn how good people behave and how they communicate, and present yourself as a good person. But I don't think it's possible to train yourself to. I I don't, you know what, and please, anybody who wants to challenge me, or have a different perspective. I just took a course in academic medicine. This is interesting. And in order to take the course, the first thing we had to do was a personality inventory. And one of the questions was, do you believe that IQ can be raised because you want to raise your IQ? Uh, you know, can you make yourself smarter because you want to be smart, or are you as smart as you were born and there's nothing you could do about it? And then the other one had to do with compassion. Like, can you train yourself to be more empathetic, to be more compassionate? And I failed because I'm old, and because of when I trained, and I was like, no, I'm very skeptical or whatever. And so in the course, we did some literature search, and there is evidence that I was wrong, that I was wrong, and that if people, if you, whatever your weaknesses are, intellectual, just focus on those, work on those things, know that you're you're not so good at some kind of processing, and just challenge yourself to exercise, practice, and you can raise your IQ. And similarly, they have demonstrated that empathy training works, and that people can become more empathetic. So I don't know. I hope whoever sent that question in, I hope I kind of answered their question.
I think you did. And if you have any follow-up, the person who asked, feel free to drop it in the chat and we can dive into it a little more. Someone else asked, do you find that working in administration was heavily dependent on your clinical expertise? Is there any advice you would give to someone who went to school for administration trying to get to that point?
You know what I did when I ask myself, it was a mixed bag for me doing administration. I as it turned out, um, I was pretty good at it, right? I mean, just whatever those outcome measures, like I'm telling you, for somebody who was not fellowship trained in critical care. So did I raise my critical care IQ because of COVID and having to work and all of that? As an administrator, yes, I think I'm kind of answering your question. When you're an administrator and you're in charge of things like specific examples, was PPEs, personal protective equipment. Everybody heard about that, right? We didn't have enough masks. We didn't have enough gowns. And so at the same time that I had to go to administration, Department of Health Services, and say, we need more PPEs, we need better PPEs, and in order for me to be effective as an administrator, I had to know what I was talking about clinically and to know that, what were the risks that we were putting the nurses and the doctors and all the respiratory therapists. So if you're going into clinical administration, hospital administration, I think it's very useful to have a clinical background, but it's an interesting question. When I assumed I agreed to be the director as a favor, by the way. I agreed to be the director of all of critical care. One of the conditions I set was I needed an administrator to help me. So the person who got hired was she had, her background was healthcare administration. I'm pretty sure that was the name of her degree. She had a degree in healthcare administration, had never done hands-on medicine. She had observed things, and she certainly came on rounds with me, and we both learned about cardiac ICU and pediatric. We learned together. We learned a lot, and I think that her judgment in terms of when things like um, getting PPEs, getting medications, she ended up doing our the burn unit, and so she had to understand the pathophysiology of burns, and she knocked it out of the park, and so I don't think she was at any disadvantage. Um, but why did she succeed? She was smart and she was dedicated. And so that's just a theme you're going to hear from me again and again and again. If you believe in this, and this is what you want to do, be a doctor, but you could also be a nurse. You could be an NP. You can be a administrator. There are so many ways to serve in healthcare.
Thank you for that answer and that insight. Somebody else asks, in your opinion, does having experiences outside of medicine, like living abroad, having a different undergrad major, knowing different languages, give you more tools when you are working in medicine? For example, when you think about treatment plans or speaking directly with patients.
Oh, absolutely. Absolutely. Whoever, thank you so much for that question, because that was so important to me. So important to me. So I, came from New York City, and, shame on me. When I was in elementary school, everybody in my class was, in those days, um, You know the show the West Side Story. I grew up in West Side Story, so I went to a public school, and there were 30 kids. 28 were from Puerto Rico. Most of them did not speak English. There was one African American girl who became my best friend because the two of us were the English speaking people in the class. So shame on me that I come out to Los Angeles. I had never met anybody that I knew from Mexico. Can you believe this? So the first thing I did, right before I skipped graduation, I was bad. I skipped graduation, and before I was an intern, I got on a bus and I traveled through Mexico on a bus, and I went to I won't name all the cities. Anybody who's from Mexico, you would know. I went to like 12 cities until I got down to a state called Oaxaca, which is pretty far down, and then I was exhausted and I had to stop. And I moved in with a family. A family took me in, and I lived down there for 2 months. Was with the family. I volunteered at the Cruz Roja, the Red Cross, and came back. And I spoke enough Spanish that, county hospital, I did a demographic study once. 2/3 of our patients at county hospital speak Spanish as a first language. So one of the smart things I did besides learning Chinese was learning Spanish because boy, it was amazing. It was amazing. People would come up to me, even with my rudimentary whatever I had learned in Spanish, in clinic. Um, Boy, these were the bad old days. It was the bad old days. You didn't have to speak Spanish. So, in the outpatient clinic, what we would do, the people who didn't speak Spanish, what you had to do was find a translator. Good luck. There were no translators. So what you would do is you would go into the next room and find a family member of another patient who spoke Spanish, and then you would bring them in. And I mean, talk about HIPAA violations and all, but have them translate. But, because I had done what I did, um, I I could translate for myself. And when a family member was translating for me, I could identify, no, 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 that's not what I was trying to say. And I could say it better in Spanish than they could. So, absolutely, I think wherever you work, learn the languages of the patients. And the Chinese, I was like the hospital Chinese translator. So, somebody that they needed a consent for a cholecystectomy up in the surgery lab, they would come and find the neurosurgery intern who spoke enough Chinese that and what I also learned is patients are so forgiving if you just try. If you just try, they know that your Spanish is like fourth, you don't really speak Spanish, but you are trying so hard. And what they will do is they will dumb down what they're speaking to your level so that I love the patients at the county hospital, obviously, and they would make make the effort to include me in the decision making, and that was so many rewarding things about the working at the county hospital. But whoever asked that question about language and communication, yes, that was one of the turned out to be one of my strongest suits, and a big part of the most very rewarding. And any effort that you put into learning languages is effort well spent.
I'm curious, Dr. Gruen, how many languages do you have experience with? I know you spent some time in Germany as well.
Yeah, so the German too. Well, no, okay. So this is the story. This is interesting to me. to me. Of course, my life is interesting to me. Big surprise. So I knew French. So as you know, history major, what I, you know, it was terrible. I did high school, I did college, and then I lived in France. So I knew French pretty well. And then I came out and whatever, my Spanish only got better during during these past 40 years. So I'm pretty good with the Spanish, and the Chinese I love. Um, I make sure I read it. Like they say, if you don't use it, you're going to lose it. So I make sure that I'm involved with Chinese. I'm tutoring, even now, tutoring recent immigrants, healthcare, Chinese, English for Chinese people, and then most recently, I am. I don't know. Is it politically correct? Can I even say this? I'm exploring my Jewish identity. My dad was Jewish. I've been Catholic for 70 years, but I wanted to learn some Jewish. So now about being Jewish. So now I'm learning Hebrew, and I can kind of go through the Old Testament, but the most fun is I joined a Yiddish club. So now, how useful is that going to be? Well, you know what? In LA, we have one of the largest Jewish, and so there's a lot of Yiddish speaking people. So, like I say, there's learn more languages. It's fun, and it just enriches your life so much and makes you a much more effective healthcare provider.
Cool. Thanks. Someone else asks, what is your honest opinion of the work-life balance practicing neurosurgery?
Oh, wow. Busted. This is the good news, and it was interesting. Last year, a couple of years ago, um, 4 or 5 of the neurosurgery residents came into my. They invited themselves to my house. Okay, these people. Okay, sure, you can come over my house, and so we're. Yes, we did a couple of shots, but no, we were talking informally, and this question came up. Dr. Gruen, now you're old, and you're towards the end of your career, and would you do this again? Would you do this again? And what I said was, and I can tell you guys from my heart, I think. In fact, I had a my performance evaluation with my chairman, who must be he's probably 20 years younger than me, 25 years, and I told him, Bill. So he's Dr. Mack is he's a brilliant guy. Also went to Columbia Medical School, did his training there. He's like a superstar. He's doing research, and he's got 5 kids, 5 kids. And so I said to Bill, do not make the same mistake that I made. And the mistake I made, I think it wasn't a big mistake. It was the decisions I made were all conditioned by my environment and what everybody else was doing. But in 1986, when you were applying for a residency, if you can believe this, one of the questions that they frequently asked you was, "Are you married?" And they weren't asking to find out if you were LGBT. The reason they were asking was, are you going to have other things going in your life such that you will not be 100% invested in neurosurgery? And that was the culture. And if you wanted to succeed, the way it seemed like, and I looked at the people who got the goodies, who got the promotion, who got invited to join the faculty, for instance, they were the ones who lived and breathed neurosurgery. And one other thing, I'm so happy for all of you young people, is that is not the culture that you're coming into. And in fact, when I interview, now that I'm interviewing people for medical school, one of the criteria that I'm uh, that I'm responsible for is to get a feeling for, um, is this person somebody who is going to figure out how to have a balanced life? And if they will, they allow themselves to have a family, to be involved in community activities, et cetera, et cetera. And that is something that we really, at medical school, are really encouraging people. And even in residency, there are, which there weren't, the residency regulations now require that a certain part of our curriculum as faculty people, that our residents have to spend a certain amount of time in well-being training, which to me is another word of talk. Well-being is balance, right? Healthy balance. Um, you know what? You're no good to your patients if you're not healthy and if you're not strong. And so, am I a role model for a balanced life? Absolutely not. But now I am. I would say that for the past few years, I've learned my lesson. I have a wonderful family. I have a supportive community, and I am just so grateful that I'm still young enough to enjoy it. And you know what? I don't regret what I missed, but what I part of the reason that I'm talking to you all is just to say, don't miss it. Life is beautiful. There are so many things outside. Healthcare is great. No doubt about it. I can't tell you you should be 60% invested in healthcare and 40%. I don't know what everybody has to figure out the right proportions, but don't let it be 90, 100% your career.
Thank you for the advice. When you had tough cases earlier on in your career, what kind of mental perseverance and thought techniques did you use in order to stay focused and persevere through it?
Oh, that's is so easy. Is so when I don't know nurses and other healthcare providers, but you know what? When at graduation, there's this Hippocratic oath, and um, it's kind of like like I say, I was Catholic, and now I'm doing Jewish, and just the concept that you have some kind of mantra, something that you tell yourself a couple of times every day. And every time that you have an encounter with a patient, you say to yourself, I am not going to hurt this person. I am here to help them. I will do, I will always do my best to help and never, you know what, there in neurosurgery, are you kidding me? Somebody is going to get hurt and you are going to hurt somebody. It just happens. But I think there's a big difference between not that you hurt somebody because you were careless or you didn't care or you were too busy, you had other things that distracted you. But I think as if you're always go into it with this person's well-being, their life. How about that? I am responsible for this person's life. And so the other thing that keeps me focused is, and just a life lesson is the golden rule, is if you always treat people the way that you would want to be treated, you're good. Keeps you focused.
Our next question says, in your work in neuroscience and neurotrauma, have you worked with veterans who have experienced traumatic brain injuries? And what challenges have you commonly observed among this population?
Well, yes, I started we didn't have one, if you could believe this, at the LA County Hospital. We have the largest number of traumatic brain injuries, probably west of the Mississippi. Um, Maybe not, but we no lots of them. Let put it that way. And it wasn't until I had been I had been working there for maybe 20 years, but about 20 years ago, 15 years ago, I set up a brain injury clinic, and um, that so the patients that I saw were primarily, here we are in LA, a lot of automobile accidents. There was a phase in it was awful. When I was a more senior person, we were the military, the Navy sent people to be trained here in Los Angeles County Hospital because we had so many gunshot wounds to the head. And at that time, we didn't have a war. So how are we going to train people to take care of patients with gunshot wounds to the head? And then there was Iraq, and the quote unquote signature wound, the signature injury from that conflict was these bombs that exploded while somebody was inside a building, so a closed container, and so all of the effects, I'm trying to think, the shock waves, and so a lot of people were coming back from Iraq, particularly with PTSD. And what was interesting is a couple of experiences I had. One was the legal aid people came to my clinic. I hope I'm answering your question. Came to my clinic and were complaining that, or the complaint was that people with traumatic brain injury who were up walking around and talking or whatever, that they couldn't get benefits, traumatic brain injury benefits. And the reason was that they would go into these, and nothing wrong with being a federal, the VA or a bureaucrat or whatever, but they would get an exam like a cursory, hey, you're walking, you're talking, whatever, so why do you need benefits? Why should we? And there were billions of dollars that had been allocated for these people, for these diseases, but people couldn't get them because they it's like mental health, right? You look okay. Why are we going to pay you, healthcare benefit dollars? Um, and then, in terms of what I know about military related healthcare, I was on a panel around the time of the Iraq War where we went to Washington, D.C., invited by the Defense Department because they were funding research into traumatic brain injury for the veterans who were coming back from various wars. And so I learned a lot about, from the research projects, you could tell what were the what were the scientific questions about brain injury that we needed to have more information about in order to provide better care. I don't know, did that ramble away too much from the question? Whoever asked the question, did I answer it?
I just wanted to know if there was if you saw the difference as far as like did you kind of did answer the question, the approach of how someone views someone with TBI. Like you said, it's kind of like mental health. Um, and there has to be you had to go through research to understand to ask the question. So in a sense, you did answer the question. Thank you.
Yeah, and nice to hear your voice. It is. I think there's also and this is what I learned from working with an underserved population, that, you know, people who don't speak English or undocumented, or, you know, there's all kinds of there's all and difficulty communicating. There's all kinds of barriers, and what you have to do as a physician is, I think it's your responsibility to make up for the deficits, that to figure out, what am I trying to say? You have to compensate for the problems that your patients have communicating and expressing how they feel. And the way to do that is not to put words in their mouths, but to, I don't know, I always assume that people are, and that's why it's important to do a good questionnaire and to do a exam, a careful exam, and listen to what the family members are saying, because my strategy, and I think it served me well, is until I rule it out, it's in the differential. So I don't know, you guys, if you know what a differential is or what a rule out is, but what it's basically saying is, I assume that people are suffering. I assume that they're having all these difficulties until they answer the question and say, no, I'm not. But that means that you have to ask, and you have to listen. And those are the, even still, I think that is what I think that's what physicians in healthcare, that there's definitely room for improvement in in the healthcare providers. We need to listen better. We need to spend more time, in spite of all the pressures to spend less time. We have to advocate for our patients, and let them tell us what's going on with them. And just one other thing, I think you'll learn, well, I don't know what you're going to go into, but, you know, the great sages of medicine, um, before there was MRI, before there were all these antibody tests and all the things that we could do now. But I think, you know, in the 19th century, a great clinician said, if you listen to the patient, they will tell you what their diagnosis is.
We have a few questions about your application process when it comes to becoming a physician. We have someone asking what you think the most valuable pre-med experience for becoming a physician is. What parts of your application do you think made the biggest difference? And what surprised you that you maybe weren't prepared for?
I think, and this is great, because these are the same questions that I'm asking these applicants now. Um, I think the most, let me just lay it out, is that especially in neurosurgery, but everybody wants to have research. That has become something, definitely for neurosurgery. You know, how many peer-reviewed articles have you published? And I think it probably starts in well, you guys could tell me, because you're undergraduates thinking about going into medicine. That was not true when I was going into medical school, but I had worked at the I had taught special ed. I had worked at the Yale Child Study Center, and then I did some research in the summers. But what I didn't do enough of, and is, you know what? Well, this is called pre-shadowing. So that's part of the big reason I'm on here. I think that this organization, and that word is so important. Don't not don't say it in a negative way. Observe physicians, nurses, as many different kinds of practitioners as you can. And one of the questions that the in the template for questions that I'm supposed to ask as an interviewer, a very important one is tell me the tell me about an experience where a physician exceeded your expectations. Tell me about an experience where a physician did not, disappointed you, and then asking questions about have you ever seen a patient or witnessed a patient who was denied health care and why, those kinds of things. You can't answer those questions unless you've shadowed. So I think that and I don't know, as I reflect, I don't know how I got into it was my handwriting, because I definitely I had not I had some research experience. I had in my heart I knew I wanted to be a doctor, but I had not volunteered in the emergency room. I wasn't a candy striper. I wasn't, I don't know, is that a term? Is that's probably a slam these days, but in those days it was an honor to be a candy striper. And so I yeah, I think that that is definitely something that will do you well, is make sure that you have an experience, and do it for yourself. If you go and you observe an and I would also try to do outpatient and inpatient, go to the emergency room. I on TV, I have to close my eyes when I see blood, right? Like my favorite show now, Chicago PD. Oh my, oh, the blood, I can't stand it. But you know what? You have to see it. You have to see what it's like. And if you can't deal with it, then don't do healthcare. But do yourself a favor, don't get yourself into healthcare and then realize that because you had no experience with it, that, oh my God, I didn't know this. Are we going to be doing this? And I was just lucky that that is not what happened to me, to be honest.
Was there anything about medical school that you weren't prepared for?
No, no. You mean about the school?
Yeah.
No, no, no. You know what? School is school. School. You know what? Well, I don't know. Now with AI, um, it's all different. But even as an undergraduate, a lot of memorization. What was different about medical school was, as a history major, I did a lot of writing. Um, and doctors are notoriously, I wouldn't say illiterate, but trying to. It's a good thing we have AI now, because some of these notes by, like, this intern just graduated from Harvard Medical School, and like, what are you trying to say? What happened? So, writing skills, fortunately, I had those. And maybe because of my self training of languages, I'm not a great language learner, but what I'm saying is, I had flashcards, and I could memorize stuff. There was a lot of memorization in those days. I don't think so much. So, I was able to ace most of the tests. And no, I wasn't. And also, I grew up, like I said, I grew up in West Side Story. So, doing a medical school, my rotations, I did OBGYN and internal medicine at Harlem Hospital. And, that there were some of my classmates who came from California, or from had never had the experience like I have had of being kind of an urban guy. They were less prepared for the environment of the patients that we had to learn about. But we all got up to speed pretty quick.
Speaking of AI, someone asked what your opinion is on AI's impact in the medical world. How do you think it will change doctors' roles? Will surgery be performed by AI, or will it train doctors?
Yeah, all of the above. All of the above. And I have to avoid um, saying I'm not scared, but I think that it is true that AI is a threat unless we very quickly understand what it's capable of doing and make sure that what we're training, everything that AI does comes from us. So you got to make sure that the trainers of AI have good values, and that but yes, just a quick anecdote. One of my a kid from China, actually, I mentored him and helped him, and he's now at Johns Hopkins, not too shabby, right, from medical school. And the first thing that they were told was use AI. When a kid who here in Los Angeles from East LA, I mentored him, pushed very hard. Together we helped him become a student at Keck, and he's like, Dr. Gruen, I can't believe I was doing this test, and they were talking about hematology and some kind of antibody test, and they had all these syllables, and I asked the teacher, could you just explain to me, I need some guidance, and my teacher said, just chat GPT, don't bother me. Oh, and then the other one. No, I have another story. I have another story. Hey, I have 15 minutes left. So I'm the director of critical care, right? So this was last year, and so I'm rounding with the trauma team. So the trauma team we're in the ICU, and there's 3 or 4 medical students, a couple of residents, and a fellow. And the fellow is somebody who has done they've done a residency in surgery, and now they're doing 2 additional years specifically in critical care trauma. So we go to a bedside, and it's still the same as it was in 1986. You guys, is the person who's going to get. We used to say the word pimped, not in the sense of pimp, but basically what it means is somebody's going to put you on the spot in front of everybody and say, why is this patient's hematocrit so low? And it's usually going to be the medical student is going to go, um, well, and they're all nervous. They know the answer, but they're so nervous that they're like choking, right? So then their resident tries to rescue them and starts to but they don't quite get it right. And so then the fellow is saying, well, he says, here's the answer. And then Dr. Gruen, why did we allow him on rounds? Dr. Gruen will say, well, actually, I'm looking here at ChatGPT, and as a matter of fact, the percentage of patients who have bleeding after a gastrostomy is something or other, and everybody turns and they give me a dirty look, and I'm like, you guys, this is only going to get worse. So, I am sure now, even now, that everybody has their phone or a computer in front of them, and they're doing chat GPT. And if they, as we're rounding, the pharmacist, everybody, AI, and you know what AI used correctly is such a boon to healthcare. It's such a boon to try and remember a piece of data that is critical to making a decision, and you don't quite remember it, but I think it was this or whatever. Nowadays, you can write to ChatGPT, and I said, I think the answer is this, and ChatGPT will say, oh, He calls me Peter. Oh, Peter, you know, maybe in 1986 that would have been a good answer, but there's been this research and blah, 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 blah. So yes, I am a big AI fan as a patient advocate. I think it will be great for patient care, and I think it will also be a good way for us as providers to do some self-assessment in private, where you can actually say, you know what, I need to read more here because I really don't know. I've forgotten this, or things have changed. So yeah, AI, I think it will, and it's only going to get better. Yeah.
Thank you, Luis. I see your hand raised. Go ahead.
Thank you. Thank you. Hi, as someone who's currently matriculating, I feel that I change my mind every day about the type of specialty that I want to go into. But the one thing that's stuck since my undergrad is that I want to go into something neuro adjacent. So I'm really curious as to, before deciding on critical care trauma, if there was other subspecialties of neuro that piqued your interest before making that decision, and maybe why you didn't go into them, or maybe why they kind of like
Okay.
bleed from your mind. You know what I
Sure.
mean? You know my answer to that. Thank you. Thank you.
Yeah. Yeah, no, 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 thanks. And by the way, nice to see a face. And by the way, where are you?
I'm in
Where are you located?
California. No offense taken
Oh,
to your
okay.
California joke, but I'm in California right now.
That's
Yeah.
fine. That's fine. The first specialty. So after I did my internship. It was brutal. And then I did my next rotation. I was at a private hospital. Basically, I was writing progress notes for an attending and holding retractors. I wasn't doing much, but then I went to Children's Hospital, and it was I was so enamored and so enthusiastic that never ever ever they told me, but the especially the nurses in the OR, they had a party when I went away. And so I was like, I'm going to do pediatrics. I love kids. Very, very, very difficult to talk to the parents of a kid who is going to die of a brain tumor, or whatever. But I wanted to be a pediatric neurosurgeon. The guy who was my co-resident, uh, he was getting married, so he had to do the children's rotation before I did, and so he loved pediatrics, and he got the fellowship, and I was like, and everybody was like, well, too bad you can't do a pediatric fellowship. So I shifted, and I was going to do general neurosurgery. I always liked trauma, and a lot of my training in those days was you know taking blood clots out of people's heads and in the ICU. But the other thing, I did a fellowship in peripheral nerve surgery, which was something that I did not get good training in. We didn't do it very much at USC. So I went down to New Orleans. I went to Germany, and that what became my specialty within the department was nerve surgery. Um, Other specialties, um, given it to do all over again, neurointerventional is just there is so much growth going to come in because you're a neuroradiologist, and you're an interventionalist, and you're a neurologist. Intellectually, it's really good. I'm just giving you ideas of things that you might want to pursue. And then with all of the advances in molecular biology, there's no neuro-oncology, very, very exciting. Uh, Neuroradiology, if you're a physicist kind of person or an engineer, you can do that. And you know what? The thing I loved at Columbia so much, but I I don't know, the culture or whatever, like, you want to be a pathologist and look at slides all day? Yeah, it's so interesting. It's so interesting. But I really wanted the hands-on. So that's why I didn't do pathology. That's why I didn't do neuroradiology. But those are and by the way, if you want balance in your life, those are great specialties: neuroradiology, neuropathology, and oh, and even outpatient neurology. I can't. The relationship between neurologist and neurosurgeon is it's touchy. It's touchy. I'll be honest with you, and I think it's just because we don't understand each other as well as we could. But my impression is that people who are are militant about balance in their lives. At least when I was training, when I was your age, was the neurologists were going to have a better lifestyle. I don't know if that's true anymore. Our neurosurgery residents, I think they're much more balanced than we were. But no, there are so many neuro adjacent things that you could do, and good luck to you.
I appreciate the insight. Thank you.
Ardavan, am I saying that right? I believe you have a
Yes, thank you. Thank you. Hello, Mr. Dr. Gruen. So my question is, so I'm personally a person who struggles with like severe dairy allergies that affect my day-to-day life. Therefore, I've like dedicated all my efforts into becoming a pediatrician, that like wanting to become a pediatrician that specializes in allergy and immunology. And however, before then, I'm looking to make an impact on the underserved community of allergy before I even become a physician. So as a neurosurgeon that you have like served underserved communities like most of your life, what advice would you give me?
So I think embedded there, maybe there's more than one question. Is the question, what advice would I give somebody who wanted to serve the underserved, and by the way, this whole, when you talk about allergy and rheumatology and all of that, that was a lot of the pediatricians at the county hospital, especially, and also at Children's CHLA. Um, those were specialties that are so important in the pediatric age group that I'll be honest. My kid, I would never even give an opinion about that. I know so little about it. Um, so I guess what what would the advice be? I guess the advice would be is that if that's what you want to do, make sure that you train at a place. And I'm not trying to sell USC, but uh, a place like USC that has a lot that treats a lot of safety net underprivileged children, because it's a big difference. And I'm sure if you're doing what you're doing, the disparity between the quality of what kids who have in from families that have insurance versus who don't. um, it's God bless you, and good luck, but jump into it. And also, I think the other thing to do is to be very public and open about it. Let people from the get-go know, this is who I am, and this is where I want to go. And get involved. You get involved in any opportunity to be on quality committees. um, and if there are when I was the director of critical care, I always made sure that as much as possible, have the medical students involved. um, and yeah, and be an advocate, but be outspoken. I don't know. I'm answering your question.
Yeah, you
It's a
got it
tough
exactly.
one.
Thank you. Thank you very much.
All right, folks, in the interest of time, we actually only have time for one more question. Like Kira mentioned in the chat, if you have a question that wasn't answered, feel free to email us and we'd be happy to reach out to Dr. Gruen to try to coordinate an answer to that question. Our last question today will be from Josue. Go ahead and ask.
Hello, I just wanted to ask, what advice would you give a 15-year-old interested in neurosurgery?
Go into something else. No, I'm just kidding. I'm just kidding. I'm just kidding. If you want to go into neurosurgery, I think it's the same for anything. Observe neurosurgery. And if you are in proximity to, for instance, at USC, I am more than happy. The residents are more than happy. But you know, make friends with people who are in neurosurgery, and if you go to a neurosurgeon's office and say, this is what I want to do. So that's kind of saying you want to have some observing and shadowing experience. If you want to specifically, if you want to do neurosurgery, you've got to do research. Do you have to, you can do research in the lab, you can do clinical research, like writing papers and doing data collection, but you definitely, you need to have research experience. And although this is not something that's that important to me personally, you got to have good grades and good board scores. It's reality.
Okay, thank you.
Thank you so much, Dr. Gruen, and we appreciate all of you for asking all those questions, and thank you to Dr. Gruen for answering them. I'm so sorry we didn't get to everyone, but like I said, please send us an email at info@prehealthshadowing.com, and we'll try to get those answered. I'm gonna hop into our wrap-up slides.
So am I dismissed?
Yeah, go. You can go ahead. Thank you so much for coming. We appreciate having you.
Thank you guys for coming. This was a wonderful experience for me. Thank you.
All right.
How do I get out of here?
We do think it is really important for folks to take a second to reflect on the session. If you have any questions, like we said, please send an email. But also, if you have any favorite moments from session, or if you have one idea that you're most excited about, please feel free to let us know. Any takeaways as well are always appreciated. Just in general, after reflecting, if there's anything you want